While everybody has always tried to get something for nothing, which in the plastic surgery world means enhanced appearance with no downtime, it's only been possible recently to have truly remarkable results with no downtime. Today, our first discussion will be about the Ultraslim Professional. So what are all those red lights? What could this possibly be doing? Well, those red lights are actually LEDs of a very specific frequency, 635 nanometers. Visible red light doesn't hurt your eyes, but it's very bright. And because it's bright, it can penetrate through your tissues. Similar to when you were a child with a flashlight in a closet and you put your hand over the flashlight and you can see your bones through your hand, it's very similar. Obviously, light went through your hand and around the bones and sometimes through the bones so you could see their outline. The Ultraslim works in the same way. It shines the light into your tissues, but with a specific wavelength that fools your fat cells into opening up the pores on their membrane. When you open up a fat cell's membrane, fat leaks out into your system. This is a normal process that fat cells undergo when they think you need more calories. By fooling them into releasing fat into your system, the bloodstream takes the fat to your liver where it is conjugated and excreted into your GI tract. Well, what does this science mean to me? What it means is that you can lose liters of fat into your tissues from your fat cells. So if you follow the post-treatment instructions, which are quite simple, such as drinking lots of water, not drinking any alcohol, adding a little fiber to your diet, you can actually excrete, on average, 1.5 liters of fat that first week. Well, in his FDA trials, over 98% of patients lost over 2 inches in combined measurements with one treatment. Compare 1.5 liters of fat for the average loss of a patient in one 32-minute session with a stick of butter-sized loss that the most popular non-invasive fat reduction device will do for you in 3 months. Compare the fact that the Ultraslim is completely painless and in fact so comfortable that people often fall asleep underneath it, to the pain often experienced by the most popular non-invasive fat loss machinery. What's the difference between Ultraslim and liposuction? Well, actually there's a huge difference between the two. And I am a big proponent of liposuction for people that need it. Liposuction is excellent for people with very specific fat deposits that they want removed permanently. The optimal patient for Ultraslim would be somebody with diffuse excess fat that they want to get rid of, anywhere from head to toe. The device is safe, it can treat any area on the body, and it opens up those fat cells. Afterwards, you need to wear a compression garment and hopefully do some physical activity to shake more fat out, compress more fat out, and thus mobilize it into your system. Additionally, the prohibition on alcohol for 7 days after treatment is due to the fact that we don't want to stop the liver from processing fat, and the alcohol and the fat conjugation compete. It's also important that you drink plenty of water after your Ultraslim treatments, as there will be fat in your circulation going to your liver and kidneys for processing and excretion. An additional benefit of the Ultraslim is that its technology was actually first approved by the FDA for skin treatment and skin tightening. So by placing the Ultraslim further away from the person, you can concentrate more light into the skin areas and actually create a tightening effect. So how can it get any better than this? Well, in fact, we're starting to discover we can add things to the Ultraslim that make treatments possible that we only dreamed about just a few years ago.
Ultraslim delivers a unique, high-power red light that stimulates the natural process of fat removal within the body, called lipolysis. Light passes painlessly through the skin layer into the fat layer. Here, the cells respond by releasing the fat through pores in the cell membrane. The released fat is drained from the cell, resulting in an immediate reduction of the fat layer. patients lose an average of 3.5 inches in 32 minutes. Over the next 72 hours, patients will experience drainage of fat, giving an additional 1.25-inch loss on average. The contents of the fat cells are then excreted through the patient's waste.